Hello and welcome to my video and slideshow for everyone to follow me, as not everyone may understand my accent. We will be discussing how IoT has played a role in healthcare and medicine. I will be talking about the advantages and disadvantages of IoT, the devices commonly used in IoT, including the social and ethical issues. IoT can transform how people live, especially older people, as it is a way of keeping old people secure and healthy in their own homes, as well as a way of improving the quality of their life. As people get older, their heart can begin to age, and so they will require ECG and blood pressure monitoring. This can also help ease the pressure within the NHS, as it can improve access to the health professionals, and this means treatment can be accessed more convenient. With connected devices, a patient's health information can be gathered quickly and the care team can be alerted if there's any abnormal readings. However, older people especially like to have face-to-face contact with the nursing staff, so with the advent of such technology there is the risk of that older people may become socially isolated. An example of IoT is a prototype fitness band with small sensors called Digilog. The advantages are that it is easy to wear and it can be accessed by people even in remote areas. Telemedicine applications will improve monitoring of health care for people who live in remote areas. The data gathered can be used for medical audits and research purposes, but this raises an ethical issue, as a patient's consent should be obtained before this is done. Another great development is the use of tracking devices for elderly people who suffer from dementia. One particular good solution is called GPS smart soles, which are inserts that can be placed inside the person's shoes, and tracking them will be much easier. If the person goes missing, an alert will be sent by email or text, letting their loved one or carer know of their location. The advantage of this is peace of mind. There is an ethical issue, as the person may not be able to give capacity to be able to give consent for you to use this device. Therefore, it is likely that the tracking sensor will be used without the person's consent. Also, there is a financial consideration, as it costs £300 to purchase the smart soles, and a monthly fee of £30 is charged if you want to make the most of the GPS tracking system. This may not, that some people may not be able to afford it. IoT has been used to prevent disease, to promote fitness, and to provide remote intervention in critical situations. The main problem is to do with confidentiality and privacy. Transferring data is a risk, since it relies on a network connections, and any problem could also cause disruption to the service. This was the case with the recent WannaCry ransom attack on the NHS. The potential for the cybercrime is on the rise, and for an individual can be identified easily by cross-referencing their personal details, such as their gender and their postcode. So it is very difficult to remain anonymous. Often the cost of acquiring IoT devices means that you may not be able to afford all, which could be regarded being ethically unfair. the cost of technology may become a problem for the NHS in the future, depending on the cost of these devices and the government funding that is available. IoT is here to stay and will feature more and more in our everyday lives. And hopefully the cost of devices will go down, as has been the case with the cost of mobile phones now.